under the patient's right arm so that it will be at the level of the right atrium. So kung muna siyang lawas, okay, dilipod ka sa knee. Knee. Axillary line, that would also be the level of your right atrium. So do not, some students would use big pillow for that dial. So the arm of that dial will be so elevated that it will not be anymore at the level of your right atrium. And then you would expect a grade of 5. Sakto mo dito kay sa ilang termo, punta ka naman ulan. Kaya place pillow. Since baby, small na, so mom is using also a small piece of cloth just to elevate the arm. Do not use that big pillow. No? Because the arm will not be anymore at the level of your right atrium. Okay, prepare area for cut down. The area will be slightly above your antecubital space. Assist the physician in the insertion of the catheter. Pinaspasa niyo, ma'am. Ikaw na pinurse na eh. Basta, do as I say. Ay, pag-una-una. Okay. Nang ba naman, assist the physician in the insertion of the catheter. Nang ba prepare area for the cut-down. Okay, this is another mistake of the student. Because the statement is prepare the area for the cut-down, they won't do nothing but just to recite the statement. Prepare the area for cut-down. So how will you prepare? You will have to disinfect the area. So disinfect. So pag demo mo din si maestra, kamang prepare the area for cut-down. So hikap-hikap din tayo. Hikap-hikap. Wala yung labuhato na next procedure na. So, meaning, you do the Isohex and then Betadine. That's how you will disinfect. So, it's done already. Naman na dun, ano? Kaganin na. So that is how you will prepare the area for the cut down. And then the physician will now incise the area. Right, din akong surgeon na, akong doctor. Okay, anesthesiahan din nila. Ano is question? So gusto masakitan. Okay, and then okay, you will now incise. Okay, blade plus your blade holder. Kung may sterile na sundang ang gamitan ng tusbuki. Puro.
You have to insert the blade. Ba?
Okay, and then the doctor will now incise and then locate the blood vessel and then incise it. Muna siya, and then, so it's just actually like your IV because you are going to introduce, and then, introduce or provide the patient with IV line or fluids. And then the doctor will have to catheter. Ano catheter? So, kanina lang siya, kanina lang imagine mo, ito ka mag-imagine. Imagine mo gamit ka, yung okay mata. Ewa ka ng mata. Oh, so that would be your catheter. You don't need a needle anymore. But the catheter or the tube, directly into the vein. And then you will have your IV. This is not this long. Okay, you will attach that one to do not forget that one also. Now you need your IV. Hang it. You're actually providing fluids and also medication through your IV. If the condition is severe, you will know, the doctor will have to know the reading in order for the doctor to know how much will be the drugs, the regulation of your IV. So you have your stop cap.
This is the stop cap.
Which will, of course, regulate the flow towards the patient. You can close towards the...
Three-way stop cap. You have to connect the end point to the... Bakante part, this is close. Kini ulay arrow. Close ni siya part, kini siya open. Indicates open. So kini siya ang close part. So kung open ka, open ni siya gikan sa IV ngayon sa manometer. Kung i-close na ito ang IV to manometer, that is close.
Okay. Another indicator niya, this one,
Ay arrow.
Anyway, when you will try to open and close it, you will see the flow. When I will open this one, the IV will flow. No? And then the IV goes, the fluid goes up to the manometer. So I'm gonna close this one. So you will actually know. No? You just have to observe. So, confirm that the 0 point will be at the level of your right atrium. Ang uban sa inyo, butang sa bed, butang sa untan, anywhere. So that should be the idea. So make sure that the 0 point will be at the level of your right atrium. So mark the mid-axillary line with indelible pencil. Kanang dili na rin ma-erase. Okay? Okay. So now, to obtain the reading, you will have to open, the IV, and let it flow towards the manometer. Okay, mag-reading man ka. So let it flow towards the manometer until it's stabilized, up to 25, what is it there? 25 to 30?
20 to 25.
20 to 25. You can have as far as 30. Okay? And then, let it flow towards, open din ka towards the patient. Okay. You will know that there is excess if it will stabilize more than normal. Okay? If there is deficit of fluid, it means to say it can be accommodated by the body of the patient. So it will flow below your normal. Ang uban gani mo, 0 pa. Patay mo siya. Ito. It will be below normal. So meaning, you will know how severe is the condition of the patient. Then, the doctor will have to adjust the flow rate. Ay, Doc, normal na siya, Doc. Ang sige, so kuha na naman 30 drops or 20 drops per minute na lang pa. Oh, Doc, it is only 2 or 5 or something, so you will also increase the flow rate. Okay, so that is how you are going to do it. And then open it towards, close the stopcock, no? Close na nimo towards the manometer. You will open it na towards the patient and then regulate the flow. If you will try to check it again, say the doctor will say, okay, check it every hour or maybe every 3 hours. So all you have to do is to open it, okay, so that it will flow towards your manometer. And then observe when, okay, the fluid will stabilize in a certain point. And that will be your reading. And then again, close it, and then let the fluid flow towards the patient. Kita man sa ninyo as you open and close the stopcock. Okay, inspect the site and change dressing. Inspect the site for 1. Okay, so you will have to provide your rationale. You have to inspect the site for signs of bleeding. During the first few seconds or minutes, when you will have to, when the doctor incised the, right after the procedure. Maybe later on, a day after, you inspect it for redness, maybe for signs of infection. But few minutes, seconds, hours, you have to inspect the site for bleeding or all throughout. Now, kung big pagyamon siya, maybe ma-dislodge catheter, no, tube. Change the dressing as necessary. Chart, okay, your reading, and of course the reaction of the patient or anything that you have observed that is not normal within the site.